Hello and welcome to Askimo TV. I'm talking today to Dr. Prasad Kothari. Dr. Kothari is a consultant ENT, head and neck surgeon in the UK. He has a special interest in head, neck and thyroid cancer, as well as in sleep apnea and snoring. Hi, Dr. Kothari, how are you?
Good morning, very well.
Dr. Kothari, let's talk today about snoring and frequently asked questions that people may have. So I'm going to start off with, is snoring dangerous? At what stage should you seek the help from a medical professional?
Right. As you probably know, snoring is extremely common and we all snore. Snoring is physiologic. That means the way we are made, we will all snore. Is snoring dangerous? If it's pure snoring, no, it isn't. Snoring is more of a nuisance, and it is not to the patient or the person snoring, but it is to the people sharing the room or the partner. So as far as health is concerned, snoring on its own without any other sleep apnea related problems is not dangerous.
What causes snoring?
Well, snoring, as I said, is physiologic, and it is to do with the way the air travels when we breathe in and out. So when we are lying down and asleep, there tends to be a slight relaxation of the muscles of the back of the throat, of the tongue. So when we breathe in, air goes through the nasal passages, the back of the nose, the back of the throat. And if there is any area which is narrowed, then that would cause increased resistance, and that would cause vibration of the tissues or vibration of the structures in the path of the passage of air. And essentially, that is what is snoring.
How is snoring diagnosed and treated if it becomes a problem? Should it become a problem?
Most people who come for advice regarding snoring are people who have been encouraged by the partners. Because if you ask the person, are you worried? He says, no, it's not me, it's my partner. So that is how most people present. If you want, if in terms of taking a history about snoring, I think it's very important that you talk to the individual, but also talk to the partner. Because what you need to know is, along with snoring, does the individual stop breathing at night? If they do, for how long? Do they snore on the back, on the side? Do they snore more when they have had some alcohol to drink? And do they sleep very well? What's the sleep pattern, etc.? So the history usually comes not from the individual, but from the partner. Sometimes people get a recording of their snoring, because these days with iPhones and smartphones, it's very easy to do that. So they actually make a recording and bring it. But that only tells you about how loud the snoring is. It doesn't tell you anything about the individual's sleep pattern.
At what stage does the snoring become a health risk? Is it only when it's coupled with the sleep apnea?
Well, there are some people who would complain if they snore very loudly. They would complain they get up in the morning with a sore throat. But that is not really a health risk. So snoring on its own has got no health risk. But it's only when it's compounded with other sleep-related problems, either obstruction or sleep apnea, that's when one has to consider it as a health risk.
So what would you suggest to help people with their snoring? What can they do to improve their lifestyle?
Right. There are certain things which are directly related as a causative factor of snoring. And that even is true for sleep apnea. One of that is weight. So any individual who's overweight with a BMI of higher than recommended for their height is a higher risk of snoring. There are people who have got nasal obstruction, so they may have things like nasal polyps or a deviated nasal septum. They would have problems, and that can be easily sorted out. If the individual snores on the back all the time, then there are ways of avoiding that, is to ask a partner to keep prodding the individual, say, turn on your side, or is to wear a t-shirt with a pocket at the back and put a little table tennis ball in it. So when they lie on the back, they're aware they're sleeping on something and they turn around. There are other devices on the market which help people to reduce snoring. There are snow pillows, which can work for the right individual. There are nasal strips which open up the nostrils. There are nasal sprays which reduce the obstruction in the nose. So there are various things which can help people to reduce the snoring.
Thank you, Dr. Kothari. Thank you so much for talking to me today.
Thank you.